Assalamu alaikum. Now I would like to discuss about the common causes of shoulder pain. Start with rotator cuff impingement or tendinopathy. In rotator cuff impingement, there is pain with abduction and external rotation. Pain with abduction and external rotation. There is subacromial tenderness. And normal range of motion with positive impingement test. Normal range of motion with positive impingement test. In rotator cuff impingement or in tendinopathy, what are the impingement tests we actually look at? We look at painful arc. We look at painful arc like pain with abduction from 0 to 120 degree, and we lower it. If there is pain between 60 to 120 degree, if while we are abducting our arm, if there is pain over 60 to 120 degree, it is rotator cuff impingement. Okay, there may be Near's test, there may be Hawkins Kennedy test, and other tests like empty can test, and there are other tests like Jobs test, Yocum test, cross-body abduction test. These are the impingement tests positive in rotator cuff impingement or tendinopathy. In tear, what happens? In tear, it is similar to rotator cuff tendinopathy, but there is no pain. There is weakness in abduction and external rotation, and age should be more than 40. But how we can diagnose rotator cuff tear? We diagnose rotator cuff tear like drop arm test. We tell the patient to abduct the arm. If he is unable to abduct the arm, we help them to abducting the arm up to 180 degree. Then we tell the patient to slowly lower down the arm from abducted position. In the when the arm is below 90 degree, then it suddenly falls. That is drop arm test. It is positive in tear, rotator cuff tear. And adhesive capsulitis, most important thing in adhesive capsulitis, you remember, there is decreased active and passive range of motion. So when we are doing the movement of the shoulder, flexion, extension, abduction, adduction, medial rotation, lateral rotation, while we are doing these movements, we can figure it out. There is decreased passive and active range of motion. An initial painful phase followed by stiffness, more than pain. And biceps biceps tendinopathy or rupture, there is anterior shoulder. A goes with B. So anterior shoulder pain, biceps tendinopathy, pain with lifting, carrying, or overhead reaching, and glenohumeral osteoarthritis. It is uncommon and usually caused by trauma. Gradual onset on anterior or deep shoulder pain. There is decreased active or passive abduction or external rotation. Decreased active or passive abduction and external rotation. So abduction and external rotation, very very important movement. And if there is pain, that is rotator tear. If there is weakness, this is tear. If there is pain, it is impingement. If there is tear, it is weakness. And decreased active and passive abduction and external rotation also seen in glenohumeral osteoarthritis. Okay, look at this x-ray. In here there is no abnormality. In shoulder joint, ball and socket variety of joint, this joint is, there is no shoulder dislocation. We have done this x-ray to look for any sort of fracture or any sort of dislocation. But the main problem on examination, there is decreased active and passive abduction, flexion, and internal and external rotation. So looks like adhesive capsulitis. If we look at the so it is looks like adhesive capsulitis. This is the adhesive capsulitis. So this is the way to diagnose the common causes of shoulder pain. Hope you enjoyed.